Joining us. We'll get started shortly. We'll just give it a minute for other participants to join. We're set. In Kenya, where our speakers are from. So let's get started. Welcome everyone. It's an absolute pleasure to see you all. Let me start by introducing myself. I'm Hannah Belaine. I'm Policy and Advocacy Officer at Results Canada. I would like to kick off our discussions today by paying respect to the Algonquin people, who are the traditional guardians of the land where the Office of Results Canada is in Ottawa. We at Results acknowledge their long-standing relationship with this territory, which remains unceded. The Algonquin people have lived on this land since time immemorial, and we are grateful to have the opportunity to be present in this territory today. So before we get started, let's dive into a little bit of housekeeping. I'll just go over a couple of things to consider for this session. So one thing to note is that the session is really a dialogue about taking action for health equity. So please feel free to engage, feel free to use the chat box, to take the conversation to social media. I'll be sharing hashtags that you can use if you want on social media. So that being said, please stay muted unless you're posing a question. And for the best experience, while our speakers are participating, you can put your Zoom view in the speaker mode. So toggle at the top right of the screen and click to test out toggling between gallery and speaker mode. Please also note that the session is being recorded, and if you're comfortable doing so, please feel free to turn on your video. Right, so tomorrow is World Malaria Day. And this is a really good time to reflect that for the first time in 20 years, we've seen declines in the outcomes of programs treating malaria, HIV, TB due to COVID-19 related disruptions. Malaria deaths and cases increasing significantly in 2020, for example, something that we're all concerned about. New estimates suggest that a child is dying every single minute, with malaria testing falling by 4%. So all around, we've lost ground in the fight against the epidemics, and the entire UN SDGs, the Sustainable Development Goals agenda, is now at risk. And for the last 20 years, the Global Fund to fight AIDS, tuberculosis, and malaria has rallied against unthinkable challenges and has been absolutely critical to expand, access to life-saving healthcare, and has been working to ensure that people everywhere thrive in communities that are free from malaria, AIDS, and TB. So that is why we're kicking off a multi-month campaign with partners and communities around the world to rally alongside the Global Fund's Fight for What Counts campaign. And that is why we're calling on Canada to invest in the Global Fund. Robin will be giving us an overview about that shortly. So today, we're joined by three amazing women to reflect on why and how we can fight for what counts. We have Rosemary Wanjiru, who's a community health worker in Nairobi's Soweto village. She's dedicated almost 20 years of her life to volunteerism and the fight against infectious diseases such as HIV and TB. We also have with us Carolyn Wasonga. Carolyn is one of 400 peer educators who are part of a Global Fund program aimed at reaching adolescent girls and young women with HIV prevention, treatment, and care. Thank you so much, Rosemary and Carolyn, for joining us today. I know it's 7 p.m. in Kenya, so we're really grateful you're making time to share your insights with us this Sunday. And finally, we have our very own Dr. Robin Waite. She's Results Canada's Policy and Advocacy Director. We'll have time for a Q&A exchange with Rosemary, Carolyn, and Robin at the end, towards the end. So now to start our webinar, let me go to Robin to set the scene. Robin, can you give us a quick overview of the Global Fund's investment case?
I sure can. And let me just share my screen because I put together some beautiful slides for everyone today. Okay, can we see my screen and slide deck? Just wanted to make sure. I'll put it on presenter mode. Okay. Can we see it as presenter mode? Looks okay? Or is it showing both slides?
We can see your notes and everything at the moment.
Okay. How do I do it just so you see this? Sorry,
Look under
guys.
the slideshow tab.
Slideshow.
And present from the beginning.
There we go.
And as we wait for Robin to finalize this, I'll share some links in the chat that you can put as well.
It's still showing that, but I'm sorry, everyone. Not sure how to just show you the one slide at a time. My apologies, but that's okay. You can see what's coming up and that shouldn't be too big of a problem. Okay, so before I dive in to the Fight for What Counts campaign that we've recently launched at Results Canada in partnership with some of our sector allies, I did want to take the opportunity to just give 2 quick updates. Since we spoke last, you would have seen that Canada's federal budget finally came out on April 7th. And we were quite pleased to see that there was, again, a bit of an increase in the international assistance envelope. So chart 5.2 shows you Canada's expenditures over the last number of years. And you can see that we're starting to see sustained, minor, not as big of increases as we'd like, but still some sustained increases over year on year. So we are now at an 8.15 billion international assistance envelope. And we had some specific resources announced that we at Results Canada are tracking and care about. One being a new $732 million investment in the global fight against COVID-19. So those of you who've been advocating with us to end COVID everywhere will know that the Access to COVID-19 Tools Accelerator is a really high impact end-to-end solution for ending the acute phase of the pandemic. And this money is most likely going to be allocated towards its implementing partners. And then we've also seen a $74 million investment for the next 4 years, starting in 2023, for strengthening global health security. So not sure exactly how that's going to be allocated yet, but really good to see that we are taking pandemic preparedness seriously and starting to plan for sustained investments in that area. I also wanted to share that on Friday, just this past Friday, actually, the Honorable Minister Harjit Sajjan co-hosted the final Reclaim the Gains campaign event in support of the Global Financing Facility for Women, Children, and Adolescents. And Canada stepped up with an additional $40 million. This money is going to go towards making sure that more women have access to skilled birth attendants, and it'll improve child and mother survival rates, making sure that children receive the rehydration treatment for diarrhea that they need. And in total, we'll save about 5 million lives by 2025 alone. So really happy to see that Canada stepped up there. This takes our total investment to 190 million over the 3 years. If you're volunteering with us, you know that we were calling on Canada to invest 250 million in total. So we didn't quite get there, but this is an increase in Canada's last investment in the Global Financing Facility. So still considered something to be proud of in terms of our advocacy this year so far. All right, so what campaign are we talking about today, though? We are all about the Fight for What Counts campaign right now. This slide gives a bit of a brief overview of the entire campaign in a nutshell. So what are we asking for? So we want to create the world we need by fighting for what counts and supporting the Global Fund to fight AIDS, tuberculosis, and malaria. So why are we working on this right now? Because we know that the pandemic has caused decades of hard-won progress towards health equity to be lost. And we know that Global Fund is our ticket to ending the epidemics and strengthening health systems for a healthier, more resilient world. Why now? Because the Global Fund is financed through what are known as replenishment cycles, and these happen every 3 years. So every 3 years, the Global Fund has to go back out and fundraise to continue its work. And that's happening this year again for the Global Fund. The United States is going to be hosting this 7th replenishment campaign with an expected conference date sometime in September. And our specific ask of Canada is for a $1.2 billion investment. And I'm going to dig in a little bit later as to how we got to this ask of Canada. And what's the purpose of this entire campaign? It's really all about securing the financial support that we need to recover from the devastating impacts that COVID-19 has had on the longstanding epidemics, to strengthen health systems for a healthier, better world for all, and to pandemic-proof the world. We know we need strong health systems in place before health crises hit in order to respond rapidly and effectively. All right, so whenever the Global Fund has a replenishment cycle, it launches a case for investment. So the investment case for the Fight for What Counts campaign is live on the Global Fund website right now. It's a really detailed document. I encourage you to go look at it, read it. There's tons of great stories embedded throughout, and a solid explanation as to why they're looking for at least $18 billion for their next 3 years of program implementation. And really, why they need $18 billion is to get back on track to ending the epidemics. It's the bare minimum needed to do that. And this graph right here, these two graphs, they show the combined incidence rate of the three epidemics and the mortality rate. And what has happened because of COVID-19, you can see the black line, that was how we were tracking towards ending the epidemics before the pandemic hit. And then the purple line, how it's starting to go in reverse, is what's happened since the pandemic and what could continue to happen if we don't do anything about the lost progress that we've seen so far. So smart people that can run mathematic models have run mathematic models and said, if we have $18 billion for Global Fund programming, we can start getting back on track and we can trend towards the global plan. So the blue line shows you within a buffer range of what's possible with this $18 billion. And the yellow line shows you the global plans to end these epidemics, where we said we would be by now with the required investment action by all parties around the table to end these epidemics once and for all. So the blue line shows you what can be achieved with this $18 billion, and the purple, what will happen if we don't have a successful replenishment this year. And just to put this in context, COVID-19 has really set back decades of progress. For the first time since the Global Fund's existence, we've seen an increase in malaria deaths and TB deaths. And we've also seen a decrease in AIDS-related deaths year on year in comparison to previous years. So Peter Sands, who is the executive director of the Global Fund, says that these numbers are a stark confirmation of what we feared might happen when COVID-19 struck. So our fear came to fruition. In many countries, COVID-19 has overwhelmed health systems, lockdowns have disrupted service provisions, and critical resources have been diverted from the fight against HIV, TB, and malaria to fight the new pandemic. So, in addition to helping get back on track to end AIDS, TB, and malaria, this $18 billion will accelerate progress towards achieving the Sustainable Development Goal number 3, which is good health for all, and universal health coverage, as well as strengthen pandemic preparedness. So specifically, $18 million will save 20 million lives, and it'll avert more than 450 million people from becoming ill from either any of the epidemics. Another really interesting, important stat to look at here on this screen would be that a yield of every single dollar invested in the Global Fund is $31 in terms of health gains and economic return. So every dollar in creates $31. So why the Global Fund? Well, the Global Fund has proven impact. Since it was created in 2002, 44 million lives have been saved. 44 million lives so far saved by Global Fund programming around the world. And in just the year 2020, 21.9 million people were put on antiretroviral therapy for HIV, 4.7 million people were treated for TB, and 188 million mosquito nets were distributed. These lines on the graph on the right show you that since the Global Fund was founded, how much services and care has rolled out across the 3 epidemics. So again, we're seeing a bit of a downward trend because of COVID-19, and we need this $18 billion so that we can get the trend going back in the right direction, reaching everybody who needs care. And behind every single life saved and every single treatment statistic, there is a story. There are people who are realizing the multiplier effect of the Global Fund's work. Their improved quality of life, they're bringing smiles to people's faces, they're building their communities and capacity. So the impact is more than just a number on a screen. So later, you're actually going to get to hear directly from Carolyn and Rosemary about the critically important work they're doing, how it's impacting their lives, and how it's impacting the lives of everybody that they have the privilege of engaging with every single day. And another reason we really like the Global Fund is because they fight for what counts in how they go about delivering their work. The how really does matter in this work. And the Global Fund is a champion of maximizing people-centered integrated health systems. So they're putting people at the center of the work that they're doing. They engage with affected communities, making sure that affected communities have a voice and continue to have a bigger voice in all of the work that they do, so that the work is delivered in a way that is needed and wanted by communities. They have a commitment to maximizing health equity, gender equality, and human rights. And they work directly with countries who are recipients of Global Fund resources to figure out how best to spend those resources in a way that the country has control and ownership over how the resources are spent. So what is our ask? We are explicitly calling on Canada to invest $1.2 billion in the Global Fund ahead of the 7th Replenishment Conference, so that we can recover from the devastating impacts that COVID has had on these epidemics, strengthen systems for health to build a healthier, more equitable, pandemic-proofed world for all. And you can see in this graph that Canada has been a long-time champion of the Global Fund. In every replenishment cycle, we've actually increased our investment. So this year, the blue, the 1.2 billion that we want to get to, would be a 30% increase in comparison to how much we contributed last replenishment, which was $930.4 million. I'll dive in a little bit more as to why the 30%, but really it's about those graphs I showed you earlier and the need being greater than ever before. And getting back on track is going to require at least $18 billion. That's a 30% increase from the Global Fund's ask last replenishment. So they're asking all their top donors like Canada to step up with another 30% increase from their last replenishments. So you can see here what Prime Minister was in power at the time of the commitment, how much was given, and how much of an increase it was from the last replenishment cycle. So a 30% increase really isn't outside the scope of the increases we've given in the past. So we're hoping now Canada steps up with the level of leadership and ambitions that they have in the past and that is required to meet the needs. Biden, who is the president of the US, as I'm sure you all know, has already signaled to the world that the US, who's hosting the replenishment, is on board with this overall $18 billion target, because they've already put in preliminary budget papers that they're wanting to contribute $2 billion a year. So they've signaled that they want to see others step up. And if others don't step up, we unfortunately won't realize the full amount of resources from the US, because the US has it in law that they can only contribute a total 1/3 of everything raised for the Global Fund. So to realize the full $6 billion that the Global Fund wants to invest, others like Canada need to step up with an ambitious 30% increase in their last pledge too. So this is our multi-month campaign. We just launched the campaign early April. We are heading into our week of action. We'll share the registration link in the chat with you all. But meeting with parliamentarians is going to be a really critically important moment for all of you to engage with us on this campaign, to build the political will so that parliamentarians are in support of our ask that we're putting to the Prime Minister and Minister Harjit Sajjan ASAP. So please do, if you haven't registered for this week of action with us. And we're really trying to line up the dominoes to get an announcement from Canada at the AIDS 2022 conference that's going to be taking place in Montreal, Canada. The reason being that it would be great to signal to the rest of the world that other countries are in support of the $18 billion ask ahead of the actual replenishment conference in September. So if Canada can make that pledge early at a really relevant, timely moment, high-level international global health conference in Montreal in the end of July, then we can demonstrate that to others and hopefully build the political will from other countries to step up with a similar contribution as well. And how does this link to the World We Need campaign that we launched in January this year? The Global Fund does all three of these things that we're really working towards. It responds directly to COVID-19. They are an implementing partner with the ACT Accelerator. They have something that's called the COVID-19 response mechanism, and they've been critical in helping countries get COVID tools out the door rapidly. They are critically important to recovering from the devastating impacts of the pandemic and getting back on track to ending these epidemics. And they're really important for preparing health systems to be stronger and more resilient to health threats in the future. So 1/3 of all of the money that the Global Fund invests goes towards health system strengthening writ large, which is a part of pandemic preparedness. And that is all from me. Let's hand it over to our awesome panelists to learn more about the impact of the work of the Global Fund.
Thank you, Robin, for that really great overview. If there are any questions for Robin, we'll have a questions and answer session later on, so you'll be able to, to ask your questions then to Robin. So yes, let's turn to Rosemary and Carolyn. Rosemary, let me start with you. As a community healthcare volunteer, who's working on the front lines, can you tell us about your work, what you do, and why you do it?
Hi, everyone. I'm glad to be in this panel. And to me, it's a great honor. My work involves serving the humanity and giving hope to humanity. Every day I visit community, different villages, different households, doing health promotion. Some of the work that I do in the community includes contact tracing, which involves visiting the members of the patient, giving them health education, screening them for TB, referring them for further diagnosis to the health facility, and also referring them to start TPT, TB preventive therapy, to prevent them from having TB progression. I also do TB interrupter tracing, which involves calling the patients who have interrupted their appointments, calling them to come to the facility, visiting their homes, encouraging them to continue with the treatment until the end of the 6 months, asking them their challenges and addressing them to help them to complete treatment. I also do health education and community mobilization for TB screening, HIV testing, COVID vaccination, childhood diseases like pneumonia, diarrhea, and others that are challenged in our country. I also do community mobilization and health education on maternal healthcare and family planning. why I do this is because I'm passionate about my community. I want to see a free community. I want to see a Kenya where people are healthy and living in dignity. I want to see diseases like TB, HIV, malaria eradicated from my country, to avoid late diagnosis, which lead to complication and suffering, taking away the family savings and stressing our community. In Kenya, we have a lot of people missing with TB. This is generally because there's a lot of misinformation, and there's need for more community health volunteers to uptake the challenge of campaigning for TB, screening and referring patients to the facility, something that is not happening because nobody is promoting or motivating the community health volunteers. In our country, there is also a lot of stigma about TB and HIV. This is hindering most people to come forward and get access to treatment and diagnosis. The poverty levels are escalating. And when poverty is in place, a lot of disease manifestation take place. So with poverty level being so high, TB is really a challenge in our country. There is also lack of enough funding in our country. Hence, few people are not willing to advocate and give education about the infectious diseases and chronic diseases. And with more funding, this would be not like the situation currently in our country. So there's also lack of enough information to most of the countrymen. Hence, there's need to do a lot of community mobilization so that we can have early diagnosis of these diseases in our country. We also lack enough diagnostic, e.g., there are very few machines doing gene expert in our country, something that is delaying diagnosis. Thank you.
Thank you for sharing that, Rosemary, and for all the amazing work that you're doing in your community. Carolyn, I would like to ask you the same question. You know, you are working in your community on the front lines. What do you do, and why do you do it?
Hi guys, sorry, the lights went off in my area, so I can't turn on my
No
camera.
problem. Thank you.
So I'm Carolyn Wasonga from Siaya, and my area of specialty is HIV and AIDS. So HIV is something dear to me, something close to me, and being a young person in my community, in my country actually, we lack that peer-to-peer mentor. Okay, what I do in my community, I'm able to get the clients, the adolescent young mothers from the facility. We follow up them for if they miss appointments. You see, these adolescent young people, most of them go to school, so maybe they won't find time to come and take to refill their medicine. So I have to do door to door, and also these adolescent young persons, they are not listed in the hospital. Why am I saying so? It's because I'm a young person and what they are going through, I get to understand them more because we are we are in the same roller coaster to understand their struggles. So me being with them me talking to them, that psychosocial support, they get to open up so much to me, and I get to know their struggles. Yeah. So with them, I also do some GBV. I'm a GBV warrior. I'm able to do. I get to follow up cases. These domestic violence for the young adolescents who are married, for the raped or defiled young persons. We are able to follow up. And in my case, I've handled 6 cases, and I'm able to take them to. We are able to let me say we are able to. We've resolved. And I'm also able to. I've been also able to do mentorship facilitation in my community. These safe space groups, we create awareness. We create awareness for use of condoms, for use of family plannings. We create awareness also in why we should practice safe sex. We as young persons, we get to be so reckless in our sexual behavior. And let me not lie to you, in an African culture, you are not able to talk to your parents about sexual intercourse. It's a taboo. It's really a taboo. So we get to sit down with young people. We discuss more about sex, what to do about sex. When it happens, like for example, it's an accident. You never meant it, but there was no condom. I get to refer these cases. They go to the hospital and take PrEP. PEP, sorry. PEP meaning post-exposure prophylaxis. And to those partners who one is dating the other person who is positive, I'm able to refer them. They get pre-exposure prophylaxis, that is PrEP. Why am I doing this? Like I said earlier, HIV is something dear to me. I'm on drugs, and this, I think, has been so much personal. Let me say personal, because I want to see young adolescents, mothers also having negative babies. We don't want to see our young kids getting infected. I have a son who is 6 years old now. He turned out to be negative, and I'm so happy. I think that is one of my achievements in this life. Like I brought a life into this world, and he's not positive. Yes.
Thank you, Carolyn. It's incredibly motivating to hear you speak, and thank you for that good news about your son.
Thank you.
You know, from your experience, Carolyn, what are the key gaps and challenges in your work, in Kenya, to defeat HIV, TB, and malaria? And then, here on the call, we have advocates ready to support your work. So how can advocates on the call with us today help?
Once again, thank you. I think how we should get help is most adolescents don't know. We don't know our rights pertaining to HIV. Like the bigger challenges that I get in my work is you'll find a client complaining that so and so abused me, so and so, like it creates so much damage that someone will just leave and not take his drugs because of the emotional damage that has caused. And these guys don't know that you can take them up, you can report these cases. And even if you report, you'll go to the police station, and the police will be like, oh, so you are taking drugs? So that's another emotional damage. You see, so it's kind of, we don't know our rights. We really don't know our rights. And then I would also like to, you guys, you help me to create more awareness in our society concerning GBV. GBV is really a problem in my society. young teenage pregnancy so much. Like, I know I can't eradicate it, but it's really messed up. So I'm really hoping that if we combine forces, like, we should stop like teenage pregnancies. Our adolescents should know their rights. They should also adhere to medication. Yeah.
Thank you so much, Carolyn, for those insights. And you're right, it's a human rights issue. Now, Rosemary, could you also share your thoughts on this? From your experience, what are the key gaps and challenges in Kenya to defeat HIV, TB, and malaria?
Okay, the key gaps in our country generally stigma. There's a lot of stigma in our country, especially for TB, HIV. For malaria, I still feel there's no enough funding. That is why we still have the disease around with us. And also there is the situation of poor infrastructure that is really contributing to these diseases being around in our society and in our country. So the advocates in this panel and appeal you advocate for more funding for our country to help us in community mobilization, community dialogue, community sensitization on these diseases to reduce the stigma rate and to reduce the high infections that we are witnessing nowadays and currently in our country, bearing in mind that there are a lot of people missing out who still have TB in the community, but they are yet to be diagnosed. So that is a risk factor, and it will be really disastrous for us if we don't find the people who are missing with TB and still in the community, bearing in mind that TB is an infectious disease, and also HIV, it's a chronic and it can be transmitted. So all the diseases need to be given a lot of seriousness, and this cannot be done without enough funds in our country. And we are really pleading for more funding from the international community. Thank you so much.
Thank you, Rosemary. And you're right that the challenges are great, but the work that you do has great impact, and is really inspiring. And I'm sure we'll be able to overcome those challenges. You shared a little bit about the work that you do earlier, but could you also maybe share with us, Rosemary, what are one of your proudest moments as a community health worker?
Helping community is my passion, and every time I support a patient or a client until they complete their treatment, a passionate moment to me. But I remember this case that always inspires me. There was this lady, she had been bedridden for more than a month. And when I reached out to her, she was really adamant, and she was not willing to go to the hospital or to seek health services. She had believed that she had been bewitched and she had lost hope, and there was no one to visit her. So when I went to reach out to her, she was ignorant at first, I would say. She had refused to come to the hospital completely. But I didn't give up, so I continued visiting her regularly until she gave in and I took her to the hospital. Unfortunately, she was diagnosed with TB, HIV, and we started the journey together, and she put on treatment both for HIV and TB. Month down the line, as we speak, she's cured of TB and she's continuing with the treatment for the HIV. And what inspires me is that she can work, she can do small businesses to bring up her children. She really, every time I meet with her, she really inspires me. She has a tendency of saying, I helped her to gain back her dignity, something that inspires me. And with this, that is just a story that I'm sharing, and there are many of so that are there. But for this special case, really inspires me because why it that I reached to her on time, maybe today she would not be around with us. And the children maybe would be very vulnerable and living as orphans. So the work that we are doing, we need to bring more people on board. And that's why we are lobbying for more funds to be able to help more families and bring dignity to humanity. Thank you.
That is a very powerful expression, Rosemary, bringing dignity to humanity. You should be proud of that and of the impact that you have in your community. Carolyn, I want to ask you the same question. Could you share with us what makes you most proud as a community health worker?
So my proudest moment was when I just started community service. I got this young lady. She was about 15 at that time. So this lady got defiled, and the father took bribe. The father took bribe, and the case was not able to go forward because the bribe has been taken. In an African culture, we have something called under the table. How can I put it? We have a saying like the snake has gotten inside the calabash, so you can't break the calabash. So now the dad, the lady is on care, so I had to take this case because the lady lost hope. She couldn't get justice. Her dignity has been lowered in the community. So I had to take this case because I remember I also got pregnant when I was a teen. So this lady left school. So after the lady gave birth, I had to take her to school. Me and the adherence counselor with our nurse at the hospital, we took her back to school, and she just sat her KCPE. I think this year she sat her KCPE, and we want to take her to high school. So that is always my proudest moment. The baby is also negative, like that I'm so proud of that. And her viral load is also low. I got her when she had millions of copies. So that is always one of my proudest moments.
Thank you, Carolyn, for sharing that. And you should be proud of that. Your work is literally life-saving. So thank you so much, Rosemary and Carolyn, for that engaging conversation. I'm personally feeling very inspired. So let's now open it up for any questions or comments from our audience. So please feel free to raise your hand or to unmute yourself and speak, or use the chat box to write down questions if you want. If you also have any questions for Robin on her presentation earlier, please feel free to ask them now. Yes, Janet.
Thank you so much for that, for sharing your work with us. It is really inspiring, and I did take note that you're saying in the community and in Kenya there's still stigma related to HIV and tuberculosis. I also wanted to ask about a little bit about COVID. Are you also finding that there is a resistance to taking COVID vaccines? And how is that working in your communities in terms of the distribution of vaccines?
Rosemary, do you want to take that question?
Sure. So for COVID, maybe people panicked, and I would say that a lot of people embrace the vaccine. So the uptake is really awesome, and people have reduced their stigma on COVID. So at least I can say the uptake of COVID and interventions were really at a good pace, unlike for the other diseases. So what I would urge maybe more seriousness to be put even in other pandemics and diseases.
Thank you, Rosemary. Carolyn, do you want to add anything to that?
Oh yes, there's a lot of stigma around COVID and most especially COVID vaccines. So there's this, like I'm in a rural setup, so we went for this funeral. We were vaccinating now door to door. So the nurse took me, our nurse took me so that I could help her key in data. So, and some villagers will be like, oh, are you trying to kill us? Is the government trying to kill us? My friend got this vaccine and he's not able to have sex. So I'm like, how is that? Even like, I'm here to protect you. COVID is real. Like, you guys, you should get vaccinated. So like, I really tried convincing them, and they took it. They really took it positively, and yeah, people are getting vaccinated, I can say, around my village.
Thank you for sharing that, Carolyn. There are a couple of comments in the chat from Elizabeth saying, you know, you have such amazing courage under difficult circumstances, and thanking you for all the work that you do. And another comment also from Eliana saying that this has been very inspiring. Any other comments or thoughts from our volunteers? Maybe one question from me, Carolyn. So how do you work with the Global Fund? Do they provide training? Do they coordinate your work? Could you maybe touch on that a little bit?
Pardon your question?
No, I was asking, how do you work with the Global Fund in terms of, do they provide trainings for you to build your capacity? Do you collaborate with Global Fund offices in your country? How does that work?
Okay, so basically I work with Kenya Red Cross. So our sub-recipient is a sub-recipient that I've been working for quite some time is Catholic Medical Mission Board, that is CMMB. So they've been conducting training. So I've been selected for a few trainings that I've been attending. I think it is with the Global Fund, yeah. But directly I work closely with Kenya Red Cross. That is funded with the Global Fund, of course. Yeah.
Thank you. Thank you for adding that. Rosemary, same question for you.
Okay, I also work under a sub-recipient, which is Maltesa International, supported by AMREF. AMREF is under Global Fund, so they do the capacity building, facilitation of some trainings and capacity building, and this is awesome. But we still need more on board to fight this pandemics and disease, and we still need more capacity building and facilitation, and teamwork pays. Thank you.
Thank you, Rosemary. And I see that Elizabeth has written in the chat saying that she'll definitely be sending a letter and making a phone call to the Canadian government to support all that you're doing. So your call for support is definitely being heard today. Okay, if there are no other questions, well, we can thank our speakers for sharing their insights and their stories with us. And we can really see how there are multiple ways of taking meaningful, high impact actions wherever we are in support of putting an end to malaria, HIV, and TB, and prevent the next pandemic. So today we can close this session by taking 2 additional meaningful actions. So the first one, Robin was mentioning earlier about the week of action that Results Canada is hosting from May 10 to June 3. So, you know, as participants, you'll have the opportunity to meet virtually with MPs and senators. I'm going to drop the link in the chat so that you have it. If you want to participate, and which we encourage you to do, you should register by May 1st. So you'll speak with decision makers directly to discuss the Global Fund, the replenishment that Robin gave an overview of, and you can discuss your ideas with them of how we can make a healthier world for all right before they go on leave for the summer months. So please make sure to register. I'm going to share the exact registration link, like the form itself here, so that you have it. It's a form that you can populate, and actually I'm going to share my screen so that we can look at it together because we have a little bit of time. So you see, it's a form that you fill out. Deadline to apply is May 1st again. So please do register, preferably even today, right after this call. You just need to populate these sections about your age, some questions about, you know, where you are registered, who your MP is, who you're representing. So nothing too cumbersome. So please do register, and it will be an opportunity to take all that you've learned and heard of today directly to the decision makers, and a really great way of making impact already. And then there's another action that we can take. So I was mentioning earlier how tomorrow is World Malaria Day. So we can make our voices heard on social media to mark this day. I'll share the link to a tweet in the chat, so you can click on the link and post it. So we're going to be tagging the Minister of International Development and the Prime Minister to demand urgent action to put an end to malaria by investing in the Global Fund. So let me put the link. So you can click on that. And then I'll share my screen too so that we can do this together. You see, when you click, you'll immediately open your Twitter account. You just have to click on tweet and it will post it. So a child dies from malaria almost every minute, despite it being a treatable and preventable disease. This World Malaria Day, we're demanding action from Canada Dev. A fully replenished global fund can protect these young lives. Let's fight for what counts. And we're tagging Justin Trudeau and the Honorable Harjit Sajjan. So tweet, there you go. I hope you're all tweeting similarly. All right. So before we leave, let's take a screenshot so that we can remember the time we had together. If you're comfortable doing so, if everyone can turn on their videos. Camille, can you take the photo?
Yes, absolutely. Hey, everybody, I'm going to give you an extra 3 seconds to turn your cameras on. If you'd like to use a little emoji in the side corner, feel free to do so. I'll give you a 3, 2, 1, so don't click on it just yet. Okay, I see a bunch of cameras on. Okay, so I'll give you 3, 2, 1. 3, 2, 1, smile. Okay, looks good. Thank you so much, everybody.
All right. So next month in May,
I just noticed Carolyn just got her camera on.
Oh, well,
We can try one more and get Carolyn in the camera.
absolutely. Okay, and those who didn't do their emoji, now's your chance to do one. 3, 2, 1, smile. Awesome. It looks really good, everyone. Looks better than the first one, so thank you.
All right, thank you, everyone. So next month, our call to action, last part of the Fight for What Counts campaign we'll continue calling on Canada to invest in local fund with focus on women and health, women and girls' health. Thank you for participating, for taking action with us. For now, bye, and enjoy the rest of your Sunday.
And before everybody goes, if anybody wants to stay back, I will be here. I know breakout rooms aren't everybody's jam, but if you want to discuss with other people who are on the call today, I will be creating breakout rooms for you to have little one-on-one discussions or small group discussions. But otherwise, you're free to go. Thank you.
Thank you again, Carolyn and Rob and Rosemary and Robin.
Bye.
Thanks, Carolyn. Thanks, Rosemary. We'll flip you an email
Thanks,
soon.
everyone.
Bye.
Bye.